The teenage nurse stood frozen on the hospital floor as armed federal agents flooded the corridor, and every officer in the building suddenly stepped back, not from the agents, from her. Minutes earlier, Dr. Victor Hale had called her a nobody to her face, blamed her for a crash she didn't cause, had security drag her out of the trauma bay while a Navy SEAL bled out on the table. But the military dog had recognized her first, and now the men with badges and clearance levels above the hospital director's pay grade were asking one question: where is Emma Carter? If this story already has your pulse up, stick with me until the end. Like this video, drop a comment with the city and country you're watching from. I want to see exactly how far this story travels. The night shift at Harborview Medical Center started the way most nights did: understaffed, overlit, and running on bad coffee and worse morale. Emma Carter was 40 minutes into her 12-hour shift when the radio call came through, and even then she almost missed it. She was restocking a crash cart in Bay 3, earbuds in one ear, the other half listening to the trauma coordinator's voice crackling over the overhead speakers. Something about an inbound, something about a military transport. She pulled the earbud out. Single patient, male, late 30s, GSW to the left shoulder, and suspected thoracic trauma. ETA 6 minutes. K9 unit on board. Do not separate from handler. Emma set down the saline bags and straightened up. A K9 unit. Military transport, 6 minutes. She moved to the bay window and looked out at the ambulance bay below. The night was cold, early March, the kind of cold that came in off the Rockies and didn't apologize for itself. The parking lot lights threw long yellow shapes across the wet asphalt. Nothing yet. She watched anyway. Carter. She turned. Denise Okoro, the charge nurse on shift, was moving fast down the hall with a tablet in her hand and the particular look on her face that meant something was already going sideways. You're on intake for the incoming. Bay 1. Dr. Hale just pulled himself from his office, which means it's either a VIP or a headache. Could be both, Emma said. With him it always is. Denise handed her the tablet without breaking stride. Get a team ready. I've got Reyes pulling the trauma cart. Emma scanned the preliminary notes as she walked. The medic's handoff was terse, the way military handoffs always were, stripped down to numbers and injury sites, no narrative padding. GSW, left shoulder, through and through, but the entry angle suggested possible lung involvement. Suspected fractured ribs, 2 or 3. Patient conscious but deteriorating. Blood pressure trending low. She already had a picture forming in her head. The bullet path, the probable bleed points, what the chest would sound like on auscultation. She pushed through the double doors into Trauma 1 and snapped on gloves. The team came together fast. Marcus Reyes, a travel nurse who'd been at Harborview for 6 weeks and already had a handle on how things moved, rolled in the trauma cart. Lily Huang, the second-year resident assigned to Bay 1, pulled up the IV setup. Emma checked the intubation tray without being asked, confirmed the laryngoscope blade, counted the ET tubes. What are we looking at? Lily asked. GSW through the left shoulder, possible pneumothorax. He's losing pressure on the way in. Emma positioned herself at the head of the bay. When he gets here, I want oxygen on immediately. We're not waiting on a formal assessment. If his breath sounds are unequal, we go for a needle decompression before Hale even scrubs in. Lily blinked. He might want to assess first. He can assess after we decompress. The patient will still be alive for it. Reyes gave a small sound that wasn't quite a laugh. He'd heard enough. The bay doors opened and the gurney came through hard and fast, 2 paramedics pushing it, a third keeping pressure on the shoulder wound with both hands. The man on the table was big, not the theatrical kind of big that made you think of gym photos, but the functional kind, the kind built for carrying weight over distance. He had a short beard going gray at the edges, and his face was a very specific shade of pale that Emma recognized. The pale of someone who'd been bleeding longer than the ambulance ride. Beside the gurney, tethered to the medic's wrist by a quick-release leash, was a Belgian Malinois. Mid-size, black muzzle, amber eyes that were scanning the room with a focus that felt almost clinical. The dog was breathing controlled and even despite the chaos. GSW 0117 hours, the lead paramedic called out. Through and through left shoulder, possible pneumo, BP is 82/50 and dropping. He was coherent on pickup, but he's been in and out for the last 4 minutes. Emma was already at the patient's side, stethoscope on his chest before the gurney locked into position. Left lung. She listened, then listened again. Diminished. Not absent, but diminished. And the trachea was... She pressed 2 fingers to his neck, slightly deviated. Tension pneumothorax building. The lung was collapsing, and the pressure was starting to push the heart sideways. I need a 14-gauge needle, second intercostal, mid-clavicular line, she said. Right now. Nobody touches him. The voice came from the bay doors. Dr. Victor Hale walked in the way he always walked in, like the room had been built for him and everyone else was a temporary inconvenience. He was 53, silver-haired, with the kind of chin that suggested he'd once been told he was handsome and had never recovered from the information. He was still pulling on his second glove. "I'll take it from here," he said. "Dr. Hale." His breath sounds are asymmetrical and the trachea is deviating. He's building tension. "I heard you, Carter." He moved to the patient without looking at her. "Step back." He needs needle decompression now. His pressure is... I said step back. The voice dropped a register. He said it the way people say things to children who've interrupted an adult conversation. "You're the intake nurse. You've done your job. Stand at the wall." Emma stepped back. Her jaw was tight. Hale put his own stethoscope to the patient's chest. Listened for 4 seconds. Moved the scope. Listened again. "Diminished on the left," he said, to no one in particular, as if he were narrating a documentary about himself. "Possible pneumothorax." He straightened up. "Lily, I want a chest x-ray before we do anything invasive." Lily hesitated. "The patient's pressure is... I know what the pressure is. X-ray first. We're not puncturing this man's chest wall on a guess." Emma stood at the wall with her arms at her sides and watched the patient's monitor. Blood pressure 79/48, heart rate climbing. She watched the oxygen saturation number and counted backward from what she knew. 3 minutes, maybe 4, with the compensatory mechanisms this man's body was running on. He'd been trained, probably, to tolerate physiological stress beyond what civilian bodies could sustain. That bought time. Not a lot, but some. She looked at the dog. The Malinois was sitting beside the gurney now, leash looped around the bed rail the paramedic had clipped it to before stepping out. The dog's eyes were on the patient, ears slightly forward, breathing still even. Then the dog looked at Emma. It was a direct look, not the scanning look it had given the room when it came in. This was something else. The dog held her gaze for a full 2 seconds, then looked back at its handler. Emma felt something move in her chest. Not sentiment. Something older than that. She looked away. Hale was ordering the portable x-ray. The technician was already moving. 2 minutes to set up, 30 seconds to shoot, then processing time. She did the math again. "Dr. Hale?" She kept her voice professional, flat. "His SAT is dropping. We're at 91% and he's on high-flow oxygen. If this is a tension pneumo, we don't have time for imaging. If it's not a tension pneumo and we needle him unnecessarily, we've introduced infection risk and potential iatrogenic injury." He didn't look up from the chart he was scanning. "Which part of that risk calculus are you confused about, Carter?" "The part where he dies while we're calculating." The room got quiet. Hale lowered the chart. He turned and looked at her with a particular expression she'd seen before. Not anger exactly, more like the look of someone who'd found a small piece of furniture in an inconvenient place and was considering whether to move it or step over it. "You're a nurse," he said, "a floor nurse. You're not a physician, you're not a trauma surgeon, and you're not in charge of this bay. So I'm going to ask you one more time. Stand at the wall, or I will have you removed from this room and written up for insubordination. Your choice." Emma stood at the wall. The X-ray tech set up. The shot was taken. Processing began. On the monitor, 76/44. Oxygen sat, 89. Emma watched the dog. The dog watched the patient. She noticed something she hadn't before. The Malinois was wearing a vest, the tactical kind, lightweight, with a small pouch on the left side. The pouch had a patch on it. She couldn't read it from where she was standing. The X-ray came back. Hale looked at it on the portable display. Something crossed his face. A brief recalibration, almost invisible. He'd been wrong, and he knew it, and he was deciding how to manage knowing it without letting anyone else know he knew it. Tension pneumothorax, he said, calmly, as if he'd seen it coming all along. Prepare for needle decompression. Emma was already stepping forward before she registered she'd moved. Carter, he said it like a period at the end of a sentence. I can do the decompression. I've done it before. She held her ground. Every second you've done it before. He repeated it slowly, like he was looking for the joke. A floor nurse has performed needle thoracostomy. On who? Where? She didn't answer. That's what I thought. He turned away from her. Lily, you're doing the needle. Walk her through it if you need to. Carter, you are done in this bay. Lily looked between them. She was 27, a resident 8 months out from medical school, and she had the expression of someone who would very much like to not be in the room where this particular conflict was happening. Yes. Okay. Yes. Emma stepped back again. She watched Lily set up the needle, watched the angle, watched the placement. She pressed her lips together. The angle was wrong, slightly wrong, not wrong enough to cause catastrophic harm, but wrong enough to miss the intercostal space cleanly and risk hitting the neurovascular bundle running under the rib. She'd seen it happen. Not often, but once was enough. Second intercostal, Emma said quietly. You want to be just above the third rib. The angle needs to come up a few degrees. Lily paused. She's not, Hale began. She's right, Reyes said from the corner. His voice was low, almost casual, the kind of calm that came from not caring very much what Hale thought of him. The angle's off. Lily adjusted, slightly, just enough. The needle went in. The hiss of released air was immediate and audible. On the monitor, the blood pressure ticked up. 79, 81. The oxygen sat climbed back toward 93. The patient's color shifted, barely, but it was there. Emma exhaled through her nose. Now, Hale said, we get a chest tube in and then imaging for the shoulder. Someone page cardiothoracic. He moved to the sink and began scrubbing, over his shoulder without turning around. Carter, you're done here. Go back to whatever bay they had you stalking. The patient is stabilizing, Emma said. I'd like to stay and monitor. That wasn't a request. He turned the water off with his elbow. Security is going to escort you out of this bay, and if you push this further, I'll have you suspended pending review. I don't care what you think you know. You are a nurse. Act like one. She looked at the patient one more time. His breathing was easier. The monitor numbers were still low but climbing. She looked at the dog. The Malinois was watching her again. Still. Focused. She pulled her gloves off. Walked out. The hallway outside Trauma 1 was cold and bright and smelled like antiseptic and old coffee from the nurse's station 20 feet down. Emma stood outside the bay doors for a moment and then started walking. Not away. She didn't know where away was. She just walked. Denise caught up with her at the nurse's station. What happened? Hale. Emma didn't elaborate. Denise's expression said she didn't need elaboration. You okay? Fine. She picked up a chart that didn't need picking up. What else is on? Nothing critical right now. You can grab the curtain area. We've got a hand laceration in 4 and a possible fracture in 7. Emma nodded and started down the hall. She'd made it maybe 30 feet when she heard the monitor alarm from inside Trauma 1. She stopped. She knew that alarm, the pattern of it, the specific rhythm of a patient whose compensatory mechanisms had finally exhausted themselves. She'd heard it in places and contexts that had nothing to do with this hospital. She turned around. Through the narrow window in the bay door, she could see the monitor. The waveform was going wide and erratic. The blood pressure readout was flashing. She pushed through the door. Hale was at the chest tube tray, gloved and gowned, prepped for a procedure that was no longer the priority. Lily was at the monitor looking at it the way you look at something in a language you sort of know, but not really. Reyes was already moving toward the crash cart. Emma went to the patient's head. He's going into obstructive shock, she said. The needle decompression bought time, but we didn't get full relief. He needs a thoracostomy. I am about to perform a thoracostomy, Hale said, his voice carrying a particular strain in it now, like a cable under load. Not with that kit. Emma scanned the tray. You've got a standard chest tube. His lung is still partially collapsed, and the pleural space has repressurized. You need a... I know what I need. Then why isn't it on the tray? Hale looked at the tray. She was right. The standard chest tube insertion kit was set up. But if the pleural pressure had rebuilt this fast, the anatomy was complicated. Adhesions, or the bullet had nicked something that hadn't shown clearly on the portable X-ray, or both. Standard approach risked missing the window. Emma had positioned herself at the patient's head without quite planning to. Her hands were on his jaw, tilting his head to maintain airway. Old reflex. Older than this hospital. Carter. Hale's voice had changed. It was quieter now, which was in some ways worse. You walk out of this bay right now, or I will end your career tonight. I have the authority, and I will use it. That is not a bluff. I know, she said. She didn't move. For 3 seconds, nobody moved. Then the patient's monitor screamed. Full arrhythmia cascade. The heart was going sideways, not cardiac arrest, not yet, but close enough that the difference was measured in moments. Crash cart, Emma said. Reyes already had it. He'd been watching, and he'd been ready. Emma's hands moved. She wasn't thinking about Hale anymore. She wasn't thinking about careers or write-ups or insubordination policies. She was looking at the patient and the monitor and calculating the gap between where he was and where he needed to be. And her body was doing what her body had learned to do a long time ago in places that didn't look anything like this hospital. 2 of amiodarone IV push. I need the pads on now, and someone get me a second large bore IV in the right antecubital. She doesn't have prescribing authority, Hale said, but it came out strangely flat, like a policy statement at the wrong meeting. You do, Reyes said to him, not unkindly. So do you want to prescribe it or not? Hale stood very still. The monitor screamed again. Prescribe it, Hale said. Emma was already going. The next 6 minutes were the particular kind of controlled chaos that looked from outside like disorder, but was actually its own precise language. Emma moved and spoke and adjusted, and the room moved with her in the way that happens when someone in a crisis knows exactly what they're doing, and the people around them sense it and fall into the shape of it almost without deciding to. The amiodarone went in. The pads went on. She watched the rhythm, called the sequence. The patient's heart converted. Sinus rhythm. Not perfect. A little fast, a little rough around the edges, but sinus rhythm. His pressure came up to 91/60 and held. Emma stepped back. Her hands were steady. She noticed them being steady and thought distantly that there had been a time when she wouldn't have noticed because it would have been unremarkable. The dog was sitting very still at the foot of the gurney. It was looking at her. And then she saw it clearly now, close enough to read, the patch on the vest. A small emblem. An insignia she recognized. Her stomach dropped in a way that had nothing to do with the patient. She knew that insignia. She knew exactly what unit it belonged to. She had worn a version of that patch herself, in a different life, in a different name, in a theater of operations that was supposed to be classified and was supposed to stay that way. She looked up. Hale was staring at her from across the trauma bay with an expression she couldn't entirely read. There was anger in it, yes, but something else too, something more calculating. Security, he said. He said it quietly. I want her out of this hospital. Emma looked at the patient one last time. His chest was rising and falling. Even. Steady. She looked at the dog, and the dog held her gaze with those amber eyes, and it made a sound. Low, barely audible, not a growl. Something that sounded almost like recognition. She turned and walked out into the corridor. The security guard who came for her was young and embarrassed about it. He walked her to her locker in the break room, waited while she pulled her jacket and her bag, and then walked her toward the staff exit. He didn't say anything. She didn't say anything either. At the door, he looked at her with the expression of someone who felt they should apologize but didn't know if they were allowed to. I'm sorry, he he said finally. You didn't do anything, she said. She pushed through the door. Outside, the cold hit her immediately. She stood on the concrete step above the parking lot and looked out at the night. The Rockies were invisible in the dark, but she could feel them. The specific pressure of altitude and mass, the way the cold came from a direction rather than just from everywhere. She pulled her jacket on. Her phone buzzed. She looked at it. Unknown number. She declined it. She started walking toward the employee lot. Behind her, through the glass doors, she heard the radio crackle at the security desk. She didn't catch the words. Then the guard's voice, louder. Wait, say that again. She kept walking. Her phone buzzed again. Same unknown number. She stopped. She stood between two parked cars in the employee lot in the cold and looked at her phone. The call ended. Went to voicemail. Then 4 seconds later, the voicemail notification appeared. She almost didn't listen to it. She almost got in her car and drove home and made tea and went to bed and dealt with whatever came next in the morning. She was tired. She was cold. She had just been thrown out of a hospital by a man who thought that being right and having authority were the same thing. She played the voicemail. The voice on the other end was male, precise, with the particular cadence of someone who had spent years giving information efficiently and expected it to be understood immediately. This message is for Emma Carter. This is Commander Dale Forsyth, Navy Special Operations Command. We are aware of the situation at Harborview Medical Center. We are en route. Do not leave the premises. Emma lowered her phone. She stood very still in the parking lot for a long moment. Then she looked back at the hospital. Through the glass doors, she could see the security guard on his radio, and she could see, distantly, moving fast down the corridor, a figure she didn't recognize. Then 2 more. They were wearing civilian clothes, but they moved the way people move when civilian clothes are a costume. Her hand gripped her phone. The voice had said, "Don't leave the premises." She looked at the doors. She looked at her car. She looked at the doors again. She walked back toward the hospital. Inside, the security guard looked up when she came through the door and opened his mouth to tell her something. She could see it forming on his face. And then his radio crackled again, and whatever he'd been about to say dissolved into the sound of a lot of things happening at once. Down the corridor, past the nurse's station, past the double doors she'd just been walked through 20 minutes ago, a set of lights she'd never seen activated before came on. Not the standard emergency lighting. Something else. Something that made the shift supervisor step out of her office with a look on her face like she was trying to remember a protocol she'd read once and hoped never to need. Emma stood in the lobby. She heard, before she saw anything, the sound of vehicles pulling into the ambulance bay. Not ambulances. Engines that were lower and steadier and more deliberate. Then the front doors opened. 3 men came in first. Then 2 more. Then a woman in a Navy uniform who moved to the front desk with the specific energy of someone who didn't wait in lines and hadn't for a long time. Behind them, the man from the voicemail. She knew it without being told. He scanned the lobby and his eyes found her and didn't move on. Commander Dale Forsyth was somewhere in his late 40s, with a jaw that looked like it had absorbed some things, and a posture that suggested it had given some things back. He crossed the lobby toward her and stopped 3 feet away. "Miss Carter," he said. "Commander?" she said. A brief silence, the kind that contained things. "You were removed from the trauma bay," he said. It wasn't a question. 40 minutes ago. He looked at her for a moment, then he looked at the set of double doors leading toward Trauma 1, then back at her. His status? Converted from arrhythmia before I was removed. Pressure was 91/60 and holding. He needed a thoracostomy completed. Standard chest tube approach was set up, not ideal for the presentation. She paused. "The K-9 is still in the bay. You should know that for your team." Forsyth nodded once. Then he turned to one of the men behind him and said something low that she didn't catch. The man moved toward the double doors. Forsyth turned back to Emma. "You have a history with that unit's medical support protocols," he said carefully. "I don't know what you're referring to," she said, just as carefully. His expression didn't change. "That's fine. We can clarify terminology later." A pause. "Are you able to assist with your patient?" "Your patient." She felt something shift in her chest. "I was suspended pending review," she said, "by Dr. Hale, hospital authority." "That's being addressed," Forsyth said. Down the hallway she heard a door open, then voices. Hale's among them, sharper than usual. And then another voice she didn't recognize, firm and clipped, doing the thing that authority does when it meets authority that outranks it. Forsyth's eyes stayed on her. "Ms. Carter, can you assist with your patient?" Emma looked down the corridor, then back at him. "Yes," she said. "I can." She walked back through those double doors for the second time that night, and this time no one stopped her. Forsyth's people had moved fast. Whatever conversation had happened in the hallway between the commander's officer and Dr. Hale, it was already over by the time Emma pushed through into the trauma corridor. She could see Hale standing outside Trauma 1 with his arms crossed and his jaw set in the particular angle of a man who had just been informed that the room had changed shape around him and was still deciding whether to acknowledge it. He saw her. His face did something complicated. She didn't stop walking. Inside Trauma 1, the room had reorganized itself in the minutes she'd been gone. Lily Huang was still there, standing near the monitor with the posture of someone trying to be invisible. Reyes had the patient's chart in his hands and was reading it with the focused look of someone who already knew things were about to shift. Two of Forsyth's people had positioned themselves near the door, not blocking it, just present, which was its own kind of statement. The patient was still on the table. His color was better than it had been. The cardiac conversion had held, but his pressure was sitting at 88/58, and there was a tension in the room that told Emma the chest tube situation hadn't been resolved the way it needed to be. She went to him. She didn't announce herself. She just went to the bedside and pulled on fresh gloves and put her stethoscope on his chest and listened. Left side, right side, the comparison between them. She moved the scope twice, pressed 2 fingers to his neck again, checked the rise of his chest against her palm. The pleural pressure hadn't fully resolved. The standard chest tube was in, placed during the window she'd been out of the room, but the drainage was sluggish, and the left lung was still not fully re-expanding. She could hear it. The quality of the breath on that side, the muffled resistance of it. "Tube's kinked," she said, "or the position's off. He's not draining properly." Lily looked at the insertion site. "I thought it was placed correctly." "It probably was when it went in. He moved during the conversion." Emma checked the tube's external position, traced the angle of it through the chest wall. "The drain is sitting against the posterior pleural wall. We need to reposition or place a second tube. Anterior approach." From behind her, near the door, she heard Hale's voice. "She doesn't have authority to make that call." Emma didn't turn around. She wasn't sure when he'd come back into the room, and she found she didn't particularly care. "Commander Forsyth is authorizing her assistance," said one of the men near the door. His voice was the flat professional tone of someone reading a memorized statement. "This is my hospital," Hale said. "My trauma bay. It's also a federal patient." A pause. "Sir." The room was quiet for a moment. Emma kept her attention on the chest tube and the drainage canister and the rate at which things were or weren't moving. "Reyes," she said, "can you set up for a second tube insertion? Anterior approach, 4th intercostal, anterior axillary line." Reyes was already moving. "On it." "Lily, I need you watching the monitor. If his rate goes above 110 or the rhythm shifts, you tell me immediately." Lily nodded. She was pale but focused. She had the look of someone who'd crossed a line in her own head, the line between following the hierarchy and following what was actually happening, and was still processing what side she'd landed on. Emma began setting up the insertion site. She worked without rushing, which was itself a particular skill. The instinct in a crisis was to speed up, to throw everything at the problem all at once. She'd learned differently. Speed lived in preparation and precision, not in motion for its own sake. The patient stirred. He'd been in and out since arrival, and this was one of the in moments. His eyes opened, pale gray, slightly unfocused, and he looked up at the ceiling and then at Emma, in the particular order of someone trying to locate themselves in a situation they don't fully understand. "Hey," Emma said, not a medical voice, just a voice. "You're at Harborview. You're in Denver. You're okay." His eyes moved. He was trying to say something. His lips formed a word, but the oxygen mask muffled it. "Don't talk," she said. "I need you to stay still for about 90 seconds. Can you do that?" He held her gaze for a moment. Something passed between them that didn't have a clean clinical name. Then he gave the smallest possible nod. "Good," she said. She inserted the second tube. The drainage was immediate and visible. A rush of air through the water seal, then dark fluid beginning to track down the drain line. She watched the quantity, the color, the rate. Not arterial bleeding, too dark, too slow. Hemothorax, probably accumulated before arrival, that the first tube hadn't reached. The patient's oxygen saturation began to climb. 91, 93, 95. His blood pressure shifted upward, 93 over 62. Emma stepped back and stripped her gloves. "He needs cardiothoracic imaging and a surgical consult," she said to the room. "The shoulder wound is secondary right now. The GSW looks like it tracked through the soft tissue and missed the subclavian, but I want a vascular surgery opinion before anyone touches it. And he needs blood. 2 units of packed red cells to start, cross-matched, and let's see where his hemoglobin is." Lily was writing. Reyes was nodding. From the doorway, nothing from Hale. Emma turned around. Hale was still there. He hadn't left. He was standing with his arms at his sides now, the crossed-arm posture abandoned, and he was watching her with an expression she hadn't seen from him before. Not anger. Not calculation. Something more stripped down than either of those. He knew. She could see it on his face. He knew what she'd just done and what it meant, and he was doing the arithmetic on it in real time. She held his gaze for a moment, then looked past him to where Forsyth had entered the room at some point in the last few minutes and was standing quietly near the wall. "He's stabilizing," she said to the commander. "He needs surgery for the hemothorax, a VATS procedure ideally, or open if they can't get the scope in. The shoulder can wait 12 hours if it needs to." Forsyth nodded. "Thank you." It was a simple phrase, 2 words, but the way he said it was not simple at all. Hale walked out. Emma watched him go. She felt something move in her chest, not satisfaction, which would have required caring about him more than she did. Something more pragmatic. The door swinging shut. She turned back to her patient. The dog was still there. She'd almost forgotten, in the business of the last 20 minutes, that the Malinois was still clipped to the bed rail. It hadn't moved during any of it. It had just watched. Now, as the room settled into a lower register, it put its head down on its front paws and exhaled a long, controlled breath, and kept its amber eyes on its handler's face. "Does he have a name?" Emma asked. She wasn't sure who she was asking. One of Forsyth's men answered. "The dog is Coda. The handler is Petty Officer First Class Dale Vickers." Emma looked at Vickers, then at Coda. "Coda's been in theater with him for 3 years," the man added. She nodded. She filed that away in the same place she filed other things she wasn't sure what to do with. The next 2 hours were procedural in the way that stabilization is procedural. A series of things that needed to happen in the right order, none of them dramatic, all of them necessary. The cardiothoracic surgeon on call arrived, reviewed the imaging that finally got done properly, and agreed with Emma's assessment in the terse, slightly territorial way that surgeons agree with nurses when the nurse has been right. Vickers went to the OR at 0340 hours. Coda went with him to the pre-op area. Emma was fairly sure that wasn't standard protocol, but no one from Forsyth's team suggested otherwise. And the OR charge nurse, a woman named Audrey who had been at Harborview for 22 years and was not easily moved by much, simply gestured to a corner of the pre-op bay and said, "He can stay there," with the tone of someone who has seen enough that a military dog in a hospital is not the strangest thing. Emma sat in the break room at 0420 and drank coffee that had been sitting in the carafe for 2 hours. It tasted like burned rubber, and she drank half of it anyway. Denise came in and sat across from her without saying anything for almost a full minute. "Hale filed the suspension paperwork," Denise said finally. "I know. He did it at 3 in the morning, which tells you something about where his head is at." Emma wrapped both hands around the coffee mug. "Where's the HR rep?" "At home. It's 4:30. Denise paused. "The commander's people have been in the administrator on call's office for the last hour. I don't know exactly what they're talking about, but Gretchen came out twice looking like she'd been asked math questions she wasn't prepared for." Gretchen was the administrator on call, a practical woman who managed hospital logistics with the energy of someone who had genuinely tried to anticipate every possible scenario and was now face-to-face with one she'd missed. What's going to happen? Denise asked. I don't know, Emma said. She meant it. She genuinely didn't know, and that wasn't false modesty or deflection. She knew what she'd done medically tonight. She knew what Forsyth's presence meant in a broad sense. What she didn't know was how it all assembled into an outcome, and she was tired enough that she'd stopped trying to model it. You want to talk about any of it? Denise asked. Not really. Okay. Denise stood up. I'm going to get the real coffee from the third floor. You want some? Yeah, Emma said. Please. She sat alone with the bad coffee and the fluorescent hum and thought about Coda looking at her across the trauma bay, about the patch on the vest, about the specific sound a commander's voice makes when it's been stripped of pleasantries. She hadn't talked about that part of her life in 4 years. Not to anyone at Harborview, not to the people she'd let close enough to share a meal with. She'd built the gap deliberately, the way you build anything you need to be solid, piece by piece, with attention to the joints. She'd been a different person then, or the same person in a different context, which sometimes amounted to the same thing. Her phone buzzed on the table. She looked at it. Unknown number. Not the same one as before. Different last 4 digits. She picked it up. Carter, she said. There was a brief pause on the other end, the specific texture of a secure line initializing. Then a voice she did not recognize, older, deliberate. Ms. Carter, my name is Captain Irene Mays, Naval Medical Command. I apologize for the hour. Emma said nothing. Commander Forsyth has briefed us on tonight's situation. I wanted to call personally to tell you that Petty Officer Vickers is in surgery and his prognosis is considerably better than it was 3 hours ago, and that we are aware of the circumstances that led to the delay in his treatment. Emma looked at the wall. Okay. I also want to tell you that there will be a formal inquiry into tonight's events specifically. The Naval Criminal Investigative Service has been notified. A pause. You should expect to be contacted. About what, specifically? About the actions that delayed appropriate care for a federal patient, and about the actions that ultimately provided it. Another pause. You're not in any trouble, Ms. Carter. I want to be clear about that. I understand. Do you have legal representation? I haven't needed to think about that yet. You may want to start thinking about it. Her tone wasn't threatening. It was practical. The way someone sounds when they're telling you to bring an umbrella because the weather has already decided what it's doing. The inquiry will be thorough. It will look at Dr. Hale's actions and the hospital administration's policies, and it will look at your background. There it was. Emma heard the words and felt them settle the way a stone settles when you drop it into water. Not dramatic, just a displacement. My background, she said. Your prior service, Captain Mays said gently. Which we are aware of, which is, as of tonight, relevant to this inquiry. Emma sat with that for a moment. She'd spent 4 years building the gap, and the gap had just closed. Not in a way she'd chosen, not on a timeline she'd managed. It had simply closed, the way things close when the world catches up with the distance you've put between yourself and it. All right, she said. Someone from our office will be in touch before noon, Mays said. Thank you for what you did tonight, Ms. Carter. I mean that. The call ended. Emma set her phone down on the table. Denise came back with the third-floor coffee. She set a cup in front of Emma and sat down again and looked at her face and didn't ask. Emma picked up the coffee. It was better. Still not good, but better. At 06:10, the surgery team called up to say Vickers was out of the OR. The VATS procedure had worked. The hemothorax had been fully evacuated, the pleural space cleared, and the lung had re-expanded. The shoulder wound was clean, soft tissue damage and a fractured clavicle, nothing vascular, exactly as Emma had assessed. He was in the recovery unit, sedated, vitals stable. When the call came through to the nurses' station, Emma was still in the break room. She heard it through the wall. She heard Denise's voice receive it, and she heard the quality of the silence that followed, and she knew. She set down the coffee and went back to the floor. Forsyth was in the hallway outside the nurses' station. He looked like he hadn't slept, which she suspected was a chronic condition for him. He turned when he heard her footsteps. He's out, she said. Yes. His voice had something in it she hadn't heard earlier in the night. Something that came after the problem is solved and you're left standing in the space where the problem was. The surgical team said the second chest tube placement was critical. Without it, he wouldn't have made it through induction. Emma nodded. I owe you a more complete conversation, Forsyth said, about several things. Tonight isn't the right time, but there will be a right time. Captain Mays called me, Emma said. Something shifted on his face, not surprise exactly, more like confirmation that he'd expected this to happen. She's thorough. She mentioned my prior service. Yes, he held her gaze directly. There's going to be a process. It's going to be uncomfortable for a period of time, but I want you to hear from me directly. What you did tonight is on the record. All of it. And who you are is on the record. That's not a threat. That's the opposite of a threat. Emma looked at him for a moment. She was trying to read him the way she read situations. Not for what they were presenting, but for what was underneath the presentation. He seemed like someone who said what he meant, which was either a genuine quality or the best possible performance of it, and she didn't have enough information yet to know which. What happens to Hale? She asked. Forsyth's expression didn't change, but something behind it did. A minor shift, like a door opening in a room she couldn't see into. That's not something I can speak to directly, he said, but I'll tell you that the NCIS inquiry has a broad mandate. It wasn't an answer. It was also, she thought, exactly as much of an answer as it was going to be right now. Okay, she said. She went back to the nurse's station. She still had 4 hours on her shift. Technically, she was suspended, but Gretchen had emerged from the administrator on call office at some point in the last hour and said, in the careful language of someone who was aware that everything she said was being mentally transcribed, that the suspension is under review pending clarification of the evening's circumstances, and that Emma should continue in her current capacity for the remainder of the shift, which was a complicated way of saying, don't go anywhere. Emma didn't go anywhere. She saw 3 patients in the curtain area, a woman with a dislocated shoulder who'd fallen off her back deck, a teenage boy with a hand laceration from a kitchen accident that his mother described in significantly more detail than the boy preferred, an older man with chest tightness that turned out to be musculoskeletal, not cardiac, and who looked profoundly relieved when she told him, and then profoundly embarrassed for having been in the ER about it. Normal things. The ordinary texture of a night shift in an emergency department. She moved through them and focused on each one the way she always focused, completely, which was the only way she knew. At 07:30, as the day shift began filtering in, she was at the nurse's station writing up her last chart when the doors at the end of the hallway opened and she looked up. 3 people she didn't recognize. A woman in a dark suit carrying a leather case. 2 men behind her, one in civilian clothes, one in a Navy uniform with the rank insignia of a lieutenant commander. They stopped at the nurse's station. The woman in the suit looked at Emma with the specific look of someone who has been briefed on who they're looking for and has found the right person. Emma Carter? Yes, Emma said. Vivian Arlo, NCIS. She opened the leather case briefly. Credentials, badge. We'd like to speak with you about last night. Do you have a private space available? Emma looked down at her chart. She had maybe 3 sentences left to write. Give me 2 minutes, she said. Arlo nodded. Emma finished the chart. She wrote it exactly the way she always wrote charts. Precisely, with the dates and times correct, and the language clinical, and the sequence accurate. She'd learned to write that way a long time ago. In a context where the chart was sometimes the only record that anything had happened, she signed it. She stood up, and as she did, she looked down the hallway, down toward Trauma 1, where the night had started, and saw, through the narrow window in the bay door, that the room was empty now. The equipment cleared, the gurney stripped and remade. She thought about Coda's eyes. She picked up her things and followed Vivian Arlo toward the conference room. She had been expecting the conversation with NCIS. She had been expecting it in the abstract, the way you expect things that you know are coming even if you can't see the specific shape of them. What she had not been expecting was who was already in the conference room when she walked in. Forsyth was there. So was a woman in her 60s in a Navy captain's uniform that Emma recognized from the photo the hospital kept in the administrator's office. Admiral Reeves, the regional Navy liaison, whose photo was there because Harborview had a trauma contract with the Naval Reserve Command. Emma had seen that photo every time she'd passed the office and never once thought it was relevant to her. But there was a third person, a man, civilian clothes, sitting at the far end of the table, mid-50s, with close-cut gray hair and a stillness that had nothing to do with being relaxed. He was looking at her when she came in, and the way he was looking at her made her stop moving. She knew him. Not from Denver, not from anything that had happened in the last 4 years. From before. From a different name and a different role in a different part of the world. He didn't smile. He nodded once, the way you nod at someone when you have too much history to summarize with an expression. Emma sat down. Vivian Arlo set her case on the table and opened it. She pulled out a folder. She was professional, methodical, not unkind. "Ms. Carter," she said, "before we begin, are you aware that Dr. Victor Hale has filed a formal complaint alleging unauthorized medical practice and insubordination?" "I assumed he would," Emma said. Arlo nodded. "And are you aware that this office has been in contact with Harborview's board of directors since 5 this morning?" Emma hadn't known that specifically, but it tracked. "What I'd like to do," Arlo continued, "is go through the timeline of last night in detail, and I'd like you to be as specific as possible about your medical decisions and the reasoning behind them." A pause. "I also want to tell you, before we begin, that this room is not adversarial. We are not here to build a case against you, we are here to build an accurate record." Emma looked at the man at the far end of the table. He still hadn't spoken. "Who are you here as?" she asked him directly. He considered the question for a moment. "Character witness," he said. His voice was the same as she remembered, low, unhurried, with the specific flatness of someone who had spent years in rooms where words had weight. Emma looked at Arlo, then at Forsyth, then back at the man. "All right," she said. "Let's start at the beginning." She opened her mouth to begin, and at that precise moment her phone buzzed on the table. She glanced at the screen. It was a text from Denise. Short, no context. Hale just walked out of the building with his personal items. "The board chair is here. People are being called into offices. Emma, whatever is happening, it's happening now." Emma read it twice. She set the phone face down on the table. She looked at the room full of people who were there because of a night she hadn't chosen and a life she'd tried to put behind her, and a soldier whose name she now knew, and a dog who had looked at her across a trauma bay and recognized something she'd spent 4 years pretending wasn't there. She took a breath. "Petty Officer Vickers arrived at 01:27 hours, she began. His initial presentation indicated a through-and-through GSW to the left shoulder with suspected thoracic involvement. I performed a primary assessment and identified asymmetrical breath sounds with tracheal deviation consistent with tension pneumothorax." She kept her voice level. Outside the conference room, somewhere in the building, a door closed with the particular finality of a door that doesn't plan to open the same way again. She talked for 47 minutes. She went through it the way she'd been trained to go through things, in sequence, with precision, without editorial. She described what she'd heard through the stethoscope and what the numbers on the monitor had been doing and what the tracheal deviation indicated and why the timeline mattered. She described the needle decompression and the angle correction and the amiodarone and the cardiac conversion. She described the second chest tube and what it had drained and why the first placement alone wouldn't have been sufficient. She did not editorialize about Hale. She described his actions the same way she described everything else, as events with clinical consequences. When she said Dr. Hale ordered me to step back, she said it the same way. She said the oxygen saturation dropped to 89%. Both were data points. Both had consequences. She let the record sort out which consequences belonged to which category. Vivian Arlo took notes, not on a laptop, on paper, in a small notebook, with a pen. Emma noticed that. It was deliberate. Paper didn't have metadata. Forsyth listened without moving. The man at the end of the table, whose name had not been offered and whom Emma had not asked to name himself because she already knew it and the room seemed to understand that, sat with his hands on the table and watched her with the specific attention of someone who is confirming a thing they already know to be true. His name was Robert Gaines. He had been a senior logistics coordinator for a Joint Special Operations Medical Support Unit that did not appear on any organizational chart that a civilian could access. Emma had worked under him for 2 years in 3 separate theaters before the unit was dissolved, and she had walked away from all of it with a new last name and a nursing license and a very clear understanding of what she was and wasn't going to talk about. She had not expected to see him in Denver. She had not expected to see him anywhere. When she finished her account, Arlo set down her pen and looked at her notes for a moment. "Miss Carter," she said, "I want to ask you about something outside the immediate medical timeline." She paused. "Your prior service, specifically your role as a forward combat medic attached to JSOC medical support operations, is documented in sealed records that have been partially declassified for the purpose of this inquiry. Are you comfortable discussing that background in general terms?" The room had a particular quality of attention now, the kind where everyone in it is trying to look like they're not waiting. "In general terms," Emma said, "your training included emergency thoracic intervention, cardiac life support in austere environments, and field surgical assist under combat conditions." "Yes." "And you left military service in 2021. "I separated, yes." "Can you tell us why?" Emma was quiet for a moment, not evasive, thinking, choosing the language that was accurate. "The unit I was attached to was dissolved following a mission review. Several people separated at the same time. It was structural." She paused, "and I was ready to leave." Arlo nodded. She wrote something. "Did you disclose your prior service when you applied to Harborview Medical Center?" "I disclosed my nursing credentials and civilian work history. My military service was classified. I disclosed what I was permitted to disclose." "Which Dr. Hale was not aware of." "Dr. Hale was not aware of it." Arlo set down her pen again. She looked at Emma directly. "One more question, and then I want to give Commander Forsyth and Mr. and the others a chance to speak." She paused. "When you were removed from the trauma bay, when security walked you out of the building, what were you thinking?" Emma looked at her. It was not the question she'd been expecting. She thought about it honestly, about the parking lot and the cold and the phone buzzing in her hand, about the specific quality of standing outside a building while something important was happening inside it that you could have stopped if the person in charge had been interested in outcomes rather than hierarchy. "I was thinking about his pressure," she said. "It was 76/44 when I left the bay. I was doing the math on how long that was sustainable." Arlo held her gaze. "Not about your career?" "No." Arlo nodded once. She wrote something final in her notebook and closed it. Then Gaines spoke. He had a way of beginning sentences without preamble that Emma remembered. No clearing of the throat, no setup, just words, as if the conversation had been happening in his head already, and he was simply opening a window into it. Emma Carter served with the 114th Joint Medical Support Element from 2017 to 2021, he said. She performed field thoracostomy procedures on 11 separate occasions in austere environments without surgical backup. She performed emergency cardiac interventions 6 times. Her record includes 0 adverse outcomes from any procedure she initiated. He stopped. She is more qualified to perform what she performed last night than most board-certified trauma surgeons who've never worked outside a hospital. The room absorbed that. Forsyth's expression didn't change, but something in his posture settled. "The suspension Hale filed," Gaines said to Arlo, "is going to need to be addressed today. Not this week. Today." "The board is already in discussion," Arlo said. "I'm aware of that." Gaines looked at Emma. "How are you doing?" It was such an ordinary question, delivered in such an ordinary tone, that for a second it almost knocked her off balance. "I'm tired," she said. "Yeah," he nodded. "This is going to get worse before it gets better. You know that." She did know that. She'd known it since the voicemail in the parking lot. Some part of her had known it earlier than that, when Coda looked at her across the trauma bay and she recognized the patch on the vest. "I know," she said. Gaines stood up. "I need to make a call." He looked at Forsyth. "Give her access to the recovery unit. She should be there when he wakes up." Forsyth nodded. Gaines left. He did it the way he'd always done things, without performance, without a closing remark, like he'd stepped out of a meeting to use the restroom and might or might not come back. Emma had seen him do it in 3 countries, and it had always had the same quality. She looked at Forsyth. "What happens now?" "Now," Forsyth said, "you go see your patient." She went to the recovery unit. Vickers was in bed 4, curtained off from the rest of the bay, with a pulse ox on his finger and a nasal cannula and 2 IVs running in his right arm. He was awake, barely, the specific just surfacing from anesthesia kind of awake, where the eyes are open but the processing is a few seconds behind. Coda was on the floor beside the bed, chin on paws, ears tracking every sound in the room. When Emma came through the curtain, Coda's head came up. The dog's tail moved. Once, twice, a slow, deliberate swing that was nothing like the anxious energy he'd shown in the trauma bay. Recognition, not alert. She sat in the chair beside the bed. Vickers' eyes found her after a moment. Gray, still slightly unfocused, but working on it. "You're the one," he said. His voice was rough from the intubation. It wasn't a question. "I'm Emma Carter," she said. "I'm the ER nurse on shift when they brought you in." Forsyth told me. He blinked slowly. "Said you put the second tube in." "Yes." He looked at the ceiling. His chest rose and fell with the careful deliberateness of someone who has recently been reminded that breathing is a privilege. "How bad?" he asked. "The lung is re-expanded. You had a hemothorax that the first tube didn't fully reach. VATS procedure cleared it. The shoulder's a fractured clavicle and soft tissue damage. They'll probably pin it in a few weeks once you're stronger." She kept her voice matter of fact. He was the kind of person who wanted information, not comfort dressed up as information. "Coda's okay?" "Coda's been here the whole time." He looked at the dog. Something crossed his face that she didn't try to interpret. "He kept going to you," Vickers said. "In the bay. Forsyth's guy told me." He paused. "Coda doesn't do that." "He's well trained," she said. Vickers looked at her sideways. "That's not what I said." She didn't respond to that. She checked his IV site, looked at the drip rate, checked the drainage output from the chest tube that was still in place and would stay in for at least another day. "You were in," Vickers said. Not a question this time. She looked at him. "The way you move," he said. "The way you talked to me in the bay when I was in and out. That's not nursing school." "I'm going to let you get some rest," she said. "Carter." She paused at the curtain. "Whatever they're doing out there," he said, "with Hale and the board and all of it, don't let them make it small. What you did last night wasn't small." She looked at him for a moment. "Sleep," she said. "I'll check on you in a few hours." She went back to the floor. The day shift was fully underway now, which meant the ER had the particular controlled density of a weekday morning. New patients arriving, overnight cases moving toward discharge or admission, the intersection of 2 staffing worlds with different tempos and different amounts of sleep. Emma moved through it in the strange, dissociated way of someone who has been awake all night and is still technically working. She saw a chest pain that turned out to be a panic attack in a 40-year-old accountant who'd been under deadline for 3 weeks. She helped a day shift nurse who was juggling 4 patients by taking the chart review on 2 of them. She was doing ordinary things, and the ordinary things felt slightly unreal, the way they do when something large is happening in the background of your life, and you're trying to maintain the foreground. At 10:15, Gretchen found her. The administrator on call was a short woman in her 50s with reading glasses pushed up on her head, and the particular look of someone who had been on the phone for 6 consecutive hours and was not finished. She appeared at Emma's elbow outside Bay 7 and said quietly, "The board wants to speak with you at 11. Conference room B." "About the suspension?" "About several things." She paused. Dr. Hale submitted his formal complaint at 0300 this morning. The board received it. Another pause, longer. They also received a letter from Naval Special Operations Command at 0830. Emma said nothing. "The letter was detailed," Gretchen said carefully. "Emma, I want you to know that I'm going to be in that room and I'm going to advocate for you. What happened last night was..." She stopped herself. Started again. Just come to the conference room at 11. Okay, Emma said. Gretchen left. Emma stood in the hallway outside Bay 7 and looked at her own reflection in the small window of the bay door. She looked tired. She looked exactly as tired as she was, which was more tired than she usually let herself look. She thought about what Vickers had said. Don't let them make it small. At 10:45, she was washing her hands at the sink in the break room when Lily Huang came in. Lily stood in the doorway for a moment with her hands in her coat pockets, and the look of someone who has rehearsed what they want to say and is no longer sure any of the rehearsal is right. I should have said something, Lily said. When he told you to step back the first time, I should have said something. Emma turned off the water and dried her hands. You're a resident 8 months out. That's not a reason. That's an excuse I've been telling myself. Lily's voice had something in it that sounded like it had been sitting on a pressure valve for several hours. I saw what you saw. On his chest, and the trachea, and the monitor. I knew. She stopped. You followed the hierarchy, Emma said. Yes. That's what you're trained to do. It was wrong. Emma looked at her. Lily was staring at the wall with the expression of someone who'd crossed a threshold in the night and was still in the room just past it, still getting her bearings. Write it up, Emma said. Whatever you're feeling right now, put it in the inquiry statement when they ask for yours. Not as self-accusation, as an accurate account of what you observed and what you did and what you would do differently. She paused. That's how it doesn't happen again? Lily nodded. Her jaw was tight. And Lily, Emma waited until the resident looked at her. You adjusted the needle angle. A small silence. Yeah, Lily said. That mattered. Lily left. Emma stood in the break room for a moment and then went to find coffee that was good enough to be worth drinking. She made it to the board meeting at 10:58. Conference room B was on the administrative floor, the kind of room that had been designed to convey institutional stability, with a long table that probably cost more than Emma made in 2 months, and framed documents on the wall that no one ever read. 6 people were seated when she arrived. The board chair, a man named Philip Strand, who had the look of someone who'd built a career on being the calmest person in every room. 2 other board members. Gretchen. Vivian Arlo, who was back with her notebook. And Forsyth. She sat down. Strand clasped his hands on the table and looked at her with the specific expression of someone who is managing several competing institutional anxieties and is trying not to let any of them show on his face with full clarity. Ms. Carter, he said, thank you for being here. I want to begin by saying that this board takes last night's events extremely seriously. She waited. We have reviewed Dr. Hale's complaint, the NCIS preliminary documentation, and the letter from Naval Special Operations Command. He paused. We have also reviewed 5 years of Dr. Hale's staffing records, complaint files, and performance reviews, which the inquiry has requested as part of its broader examination. That was new information. She kept her face neutral. What we have found, Strand said carefully, is a pattern. He looked down at a document in front of him. In the last 5 years, 14 nursing staff members filed internal complaints about Dr. Hale's conduct. 11 of those complaints were dismissed without formal review. 3 resulted in written warnings to the complainant rather than to Dr. Hale. Emma sat with that for a moment. 14 people. She had known she wasn't the only one. She hadn't known the number was 14. In addition, Strand continued, we have identified 3 cases in the last 18 months where documentation suggests that Dr. Hale's clinical decisions resulted in delayed treatment that led to adverse patient outcomes. 2 of those cases are already subject to ongoing liability review that was not brought to the full board's attention in a timely manner. He said those last words with the careful flatness of someone whose lawyers had advised him on exactly how much to say. Ms. Carter, he said, the suspension filed by Dr. Hale is rescinded, effective as of this conversation. Emma nodded. You will be paid for the hours you were removed from the floor, and this board is formally requesting that you remain available to assist with the NCIS inquiry as it continues. I'll cooperate fully, she said. Strand looked at her for a moment. He seemed like he wanted to say something that wasn't in the document in front of him and was deciding whether this was the right room for it. He decided it wasn't. Thank you, he said. That's all for now. She stood to leave. Miss Carter? Forsyth's voice. She turned. He was looking at her with the same directness he'd used in the lobby at 4 a.m. There's one more thing. Vickers is asking for you. She went back to the recovery unit. Vickers was more awake now. The anesthesia fog had thinned, and he was sitting up slightly, not much, the chest tube wouldn't allow for more, with his arms on the bed rails and the look of someone who had been lying flat long enough that even 5 degrees of incline felt like a victory. Koda was still on the floor. His ears moved when Emma came through the curtain. His tail didn't. There was someone else in the room. A woman, standing near the window, late 40s, short gray hair, in civilian clothes that fit like they'd been chosen to not attract attention, but sat on her body with the posture of someone who'd worn a uniform for a long time. She turned when Emma came in, and Emma looked at her and felt something she hadn't felt in 4 years. The specific recognition of a face from a context that was supposed to be closed. Major Denise Hartley. Formerly Major Denise Hartley. JSOC Medical Operations 114th Element. She had been Emma's direct supervisor for the first 18 months. "Hey, Carter," she said. Same voice. A little more gray than Emma remembered, but the same voice. Emma stopped moving. She looked at Vickers. He watched them with the particular awareness of someone who understands that something is happening in the room that predates him. "You're here because of Gaines," Emma said to Hartley. Not a question. "I'm here because Dale called me at 05:30 and told me what happened," Hartley said. She meant Forsyth. "And because I know you, and I knew this was going to be the kind of morning where you handle everything correctly and don't talk to anyone about how you're actually doing." Emma looked at her for a long moment. "I'm fine," she said. "Yeah," Hartley said. "I know what you look like when you're fine. This isn't it." Emma sat down in the chair beside Vickers' bed, not because she was overwhelmed, because her body had been awake for 11 hours and it seemed like a reasonable thing to do. Koda put his head on her knee. She looked down at him. He looked up at her. Those amber eyes, patient and direct, and not asking for anything except the fact of her presence. She put her hand on his head. He didn't move. "He found you in the bay," Hartley said. "Even in all that noise, with all those people. He found you." "Dogs have good noses," Emma said. "He wasn't smelling you," Vickers said. His voice was rough but clear. "He was reading you. There's a difference." Emma didn't answer. She didn't have a clean answer for that, so she let it sit. The afternoon moved. She went back to the floor. She finished the tail end of her shift, and then, because there was no one to relieve her on 2 of her patients, and because going home felt somehow less manageable than staying, she stayed for another 2 hours. She saw a toddler with a forehead laceration whose mother was significantly more distressed than the toddler was. She helped an elderly man who'd been waiting 4 hours understand that his paperwork had been misfiled, and she went and found it and fixed it herself because the alternative was letting him wait another hour, and that wasn't happening. She did the ordinary things. The ordinary things were the job. At 15:40, she was in the hallway outside the nurse's station when her phone buzzed. She looked at it, expecting Denise or a shift reminder or something about the NCIS inquiry timeline. It was a message from a number she didn't have saved, but the area code was one she recognized. Maryland, D.C. corridor. The message was 4 words, "Check your email, tonight." She stood in the hallway with the phone in her hand and the fluorescent light overhead, making everything slightly flat and overlarge, the way hospitals look at 5 in the afternoon. She went to the break room and opened her email on her phone. Most of it was routine, shift updates, a union newsletter, a reminder about mandatory training due in April. But there was one email, timestamped 1532, sender listed as NAVSOC HR correspondence, classified routing, subject line blank. She opened it. It was short, 3 sentences. Records pertaining to your service with the 114th Joint Medical Support Element have been reviewed and partially declassified in connection with the current inquiry. A formal request has been submitted to restore your operational medical qualifications under the Naval Reserve Medical Auxiliary Program. Your response is requested by 800 Friday. Emma read it twice. She set the phone on the table. Outside the break room, she could hear the ordinary sounds of the hospital: monitors, footsteps, someone laughing at the nurse's station, a PA announcement about a patient pickup. Everything going on the way it always went on. She picked up the phone and read the email a third time. They wanted her back. Not Harborview. The Navy. The reserve program. The part of the world she'd walked away from 4 years ago, when the 114th was dissolved, and she'd told herself clearly, deliberately without ambiguity, that she was finished with it. She put the phone in her pocket and went back to the floor. She was 3 steps out of the break room when she heard it. From down the hall, from the direction of the recovery unit, a monitor alarm. Not a routine alarm. The kind with a specific pattern she knew, in the exact same way she knew the patterns of things she'd learned before this hospital, before this version of herself. She was already moving before she knew she'd decided to. She hit the double doors at a run, badge out, pushed through to the recovery corridor. Bay 4's curtain was being pulled open by a recovery nurse who had the look of someone who'd just arrived at a situation that had changed in the 60 seconds since they'd last checked. The monitor was showing a rhythm Emma recognized, and the blood pressure was crashing, and Vickers' face had gone the gray color again, different from the earlier gray, this one specific to vascular. "What happened?" Emma said. "He was fine," and then the recovery nurse gestured at the monitor. He sat up too fast, the chest tube dislodged, and his pressure just... Coda was on his feet, pressed against the far wall, tail low, watching Vickers with locked focus. Emma looked at the chest tube. The dislodgement was partial. The tube hadn't come out, but the seal was compromised. She could hear it, the wet sound of air tracking somewhere it shouldn't be. The pleural space was repressurizing. He was retensioning. His whole face was tight with something that was trying not to be panic and not entirely succeeding. "Vickers," she said. Her voice was the particular tone she'd learned for this specific situation. Not loud, not sharp, just present. Something to hold on to. "Look at me." His eyes found hers. "I've got you," she said. "Stay still. Do not move your upper body. I need you to breathe shallow and slow. Can you do that?" He nodded, small. She was already reaching for the seal, already doing the assessment. She had maybe 2 minutes, possibly 3, if his military conditioning bought him the extra seconds, before this became a situation with a different kind of outcome. "I need a thoracostomy kit, and I need it now," she said to the recovery nurse. 14 gauge, and tell someone to get cardiothoracic on the phone, not page call. The nurse was going. Coda made a sound from the wall, low, not a bark, a communication. Emma looked at Vickers, and Vickers looked at her, and the monitor screamed, and somewhere behind her at the entrance to the recovery unit, she heard a voice she recognized. Hale's voice, loud and purposeful, saying, "I need access to that patient. He is under my care, and I have the authority to..." Emma didn't turn around. She had 90 seconds. She had a patient whose chest was collapsing for the second time in 12 hours, a dog watching from the wall like a witness, and a man whose voice she would recognize anywhere trying to get through a door. She had the kit in her hand. She had exactly what she needed, and she used it. The seal reseated with a sound she felt more than heard. A small, definitive click of pressure equalizing, and Emma held it in place with both hands while the monitor above her began its slow climb back toward readable numbers. 74/42. 78. 81. She was aware of Hale's voice still at the entrance to the recovery unit, louder now. The words were getting cleaner as the alarm volume dropped and her own focus narrowed. He was saying something about patient authority and his position and the fact that no one had the right to supersede his clinical decisions on a patient under his care, and there was a particular pitch in it that she recognized. Not confidence. The performance of confidence, which was what confidence sounded like when it had stopped believing in itself. She didn't turn around. "Vickers," she said. "Pressure's coming up. The seal is holding. Don't move." He had his eyes on her. They hadn't left her face since she'd told him to find them. He gave a small, controlled nod. The nod of someone who has been trained to receive critical information under stress and respond to it without wasting motion. His color was coming back. Still bad, but coming back. The recovery nurse reappeared at her elbow with the thoracostomy kit, slightly out of breath. Cardiothoracic is on the line. Tell them I've reseated the tube and the seal is holding, pressure is recovering. Ask them if they want him moved to a monitored surgical bed or if they'll come down here. The nurse went. Behind Emma, she heard the voice at the entrance shift register, from loud to very quiet, which was its own kind of escalation. And then she heard Forsyth's voice, lower, with the specific cadence of someone who is not raising their voice because they don't need to. She focused on the monitor. 86/57. Vickers' breathing was steadying. The chest tube drainage was tracking again, appropriate color and rate. Coda moved away from the wall. He crossed to the bedside and put his head next to Vickers' hand on the rail. Vickers didn't move his arm. He just pressed his palm against the dog's head, a small, deliberate contact, and kept his eyes on Emma. "You good?" she asked him. "Getting there," he said. His voice was rough but even. "The tube shifted when you sat up. It's back in position. You're going to need to stay flat for the next 12 hours. I don't want you testing the seal again." "Understood." She straightened up and turned around. Hale was at the entrance to the recovery unit. He had his ID badge visible and his hands at his sides, and the look of a man who had made a decision about how this was going to go and was still committed to it even though the room had not agreed. Forsyth was beside him, not touching him, not blocking him physically, just standing in the space between Hale and the interior of the unit with the quality of a weight that didn't need to announce itself. Two of Forsyth's people were behind him, not agents, the commander's staff, the ones who'd been moving through the hospital since 0200 with the quiet purposefulness of people who were building a record. Hale looked at Emma across the length of the recovery unit. She looked back. She was holding a thoracostomy seal in one hand. She had a patient behind her whose pressure was now 90/60 and climbing. She was wearing the same scrub she'd put on 16 hours ago, and her hair was escaping whatever she'd done with it at the start of the shift. And she was aware of all of this, and it didn't seem particularly relevant. "You need to leave this unit," she said to Hale. "This patient he's not your patient anymore." She kept her voice flat, not hard, just factual. The board meeting was at 11. "Check your phone." Something moved across Hale's face. It was brief, a kind of recalibration, the way a machine sounds when it's trying to run a program on a system that's no longer configured for it. Then it was gone, and what replaced it was something more rigid, more deliberate. "Whatever the board decided this morning," he said, "doesn't change the fact that you performed an unauthorized procedure on a patient in my unit." "Commander Forsyth authorized her assistance," said one of the staff behind Forsyth. The same man who had said it in Trauma 1, 9 hours earlier. Still the same flat delivery, still the same absence of inflection that was itself a form of emphasis. "Naval authority does not supersede hospital clinical governance," Hale said. "When the patient is federal," Forsyth said quietly, "it does." The silence after that was the kind that has weight. Hale's jaw moved. He was doing something with his expression that was meant to be composure, but was arriving as its nearest functional neighbor, which was endurance. "This isn't over," he said to Emma. She looked at him for a moment. He seemed, standing there, like someone who had spent a long time being the largest thing in whatever room he was in, and was only now encountering the possibility that this was a contingent property of the rooms he'd been allowed into, rather than a fixed property of himself. "I think it is," she said, and turned back to her patient. She stayed with Vickers until cardiothoracic came down at 16:20. The surgeon was a compact Korean-American woman named Dr. Park, who reviewed the tube position on portable imaging, confirmed the seal, and told Vickers in the direct, slightly impatient way of someone who has no interest in softening clinical reality that he had been remarkably close to needing to go back to the OR, and that he should consider lying still a reasonable life goal for the next 24 hours. Vickers said, "Yes, ma'am," with the specific tone of a man who has been given orders by competent people for most of his adult life and knows how to recognize one. Dr. Park looked at Emma on her way out. "Good call on the seal," she said. "Fast." She paused. "Who are you exactly?" "ER nurse," Emma said. Park looked at her for a moment with the expression of a person deciding whether to press further. She decided not to. "Good," she said, and left. Hartley appeared at the curtain at 16:45. She'd been somewhere in the building for most of the day. Emma had seen her twice in the corridor, once on the phone, once in conversation with Arlo. And now she had the look of someone who had finished a round of things and was checking on the one item that wasn't on the list. "You should go home," Hartley said. "I know." "I mean tonight, not in an hour." Emma looked at Vickers. He was asleep, real sleep, not the earlier fog of anesthesia, but the deep, flat sleep of someone whose body has been through significant physiological stress and has simply turned itself off. Koda was on the floor with his nose on his paws and one eye cracked open. "I'll go," Emma said. She went. She drove home through the early dark of a March evening in Denver, the Rockies invisible in the cloud cover, the highway loud with commuter traffic. She stopped at a light on Colfax and sat there while the signal counted down and found herself thinking about nothing specific. Not Hale, not the email from NavSoc, not the inquiry, not the sound of Vickers' monitor, just the light and the traffic and the cold coming in at the edge of the car window she'd cracked 2 inches because the air in the car felt too closed. She got home. She made food she barely tasted. She showered and sat on her couch and was asleep before she'd made any conscious decision about it. She slept for 9 hours, dreamless, the particular deep nothing of complete exhaustion. She woke at 06:30 to 4 missed calls, 2 from Denise, 1 from an NCIS number, 1 from Hartley, and a text from Gretchen that said, "Board called an emergency session, 9 a.m., please be here." She was there at 08:45. The conference room was more crowded this time, the full board. 7 members instead of the 3 from the previous meeting. Arlo and her partner, Forsyth, Gaines, who had apparently returned to Denver sometime overnight. Hartley, a man Emma didn't recognize who turned out to be the hospital's liability counsel, and a woman from the state medical board's oversight office, there in an official monitoring capacity, which meant that what was about to happen was going to be a matter of public record. Hale was there too. He was seated at the far end of the table with his own counsel beside him, a man in an expensive suit who had the look of someone paid to make bad facts look like complicated facts. Hale himself looked like he'd slept, which was more than Emma had done before she'd gone home. His expression was the kind of blank that people construct carefully when they know they're being watched. Emma sat across the table from him, 1 chair down from center. Gaines was 2 seats to her left. Hartley was against the wall. Philip Strand called the meeting to order. "This session has been called," he said, "to address the findings of the preliminary NCIS inquiry as they relate to the events of March 4th, and additionally to address broader findings from the concurrent review of Dr. Hale's tenure as ER director." He looked at his documents. "I want to begin with the medical review." What followed was 40 minutes of structured testimony that Emma had already lived through and now witnessed from outside, as if the events of the previous night were being reassembled into a shape that other people could hold. Arlo presented the timeline. A Navy medical officer presented the clinical assessment of Vickers' injuries and the treatment decisions made at each stage. The NCIS documentation was read into the record. Emma was asked to confirm specific details 3 times. Each time she answered precisely. No elaboration, no emotion, no editorializing. She had learned that lesson in a different kind of room, in a different kind of proceeding, a long time ago. Then Strand said, "I'd like to turn to the broader review." He looked at the board member to his right, a woman named Sandra Osei, who had been taking notes the entire time, and who now opened a folder that had the particular thickness of something that had taken longer than a day to compile. "The review of Dr. Hale's tenure as ER director has identified the following," Osei said. 14 internal complaints filed by nursing and resident staff over 5 years, 11 dismissed without review, 3 resolved with disciplinary action directed at the complainant. She turned a page. 3 patient cases with documented adverse outcomes linked to delayed or modified treatment protocols. In 2 of those cases, the delays are directly attributable to Dr. Hale overriding staff recommendations. In one case, a patient was discharged against nursing staff's recommendation and was readmitted 48 hours later with a condition that required surgical intervention. She turned another page. Additionally, the review has identified a pattern of documentation alteration. In 11 cases over the past 3 years, incident reports or nursing notes were modified after the fact in ways that shifted clinical responsibility away from Dr. Hale and toward other staff members. She paused. We have IT confirmation of the modification timestamps. The room was quiet. Hale's counsel leaned to his ear. Hale listened, and his expression did not change. Emma watched him. He was good at this. The stillness, the controlled blankness. She'd seen it before, in the hospital and in the moment in the recovery unit when he'd arrived at her shoulder. It was the skill of someone who had been the most powerful person in the room so consistently that they'd developed a particular fluency in managing the optics of that power, even when the power was gone. What he hadn't developed, she thought, was any fluency in being simply wrong. Given these findings, Strand said, the board is prepared to make a formal determination today. He looked at Hale. Dr. Hale, effective immediately, you are placed on administrative suspension pending the outcome of the full NCIS inquiry and the state medical board's concurrent review. Your hospital credentials are suspended. You are not to enter any clinical area of this facility. Hale's jaw moved. I'd like to speak to... You'll have an opportunity, Strand said. Your counsel can request time from the board secretary. Not today. The counsel said something quietly to Hale. Hale sat back. Emma looked at her hands on the table. She wasn't sure what she'd expected to feel at this moment. Not triumph. She didn't have the energy for triumph, and it wouldn't have been the right shape anyway. What she felt was closer to the feeling after you've been holding tension in a muscle for a very long time and you finally let it go. Not relief exactly. The absence of a weight she hadn't realized she'd been carrying continuously. She looked up and found Gaines watching her from 2 seats down. He gave her a small nod. She gave it back. Ms. Carter, Strand said. She looked at him. This board would like to formally acknowledge that your actions on the night of March 4th were consistent with the highest standards of patient care. The evidence is clear that your medical interventions directly preserved Petty Officer Vickers' life, and that the delays in his treatment, delays caused by the removal of a qualified medical professional from the trauma bay, constitute a serious institutional failure. He paused. This board is not that failure. We are, however, accountable for the conditions that allowed it. Emma looked at him. He seemed like he meant it. She gave him credit for that. The suspension filed against you is rescinded in its entirety, he said. Your record will reflect no disciplinary action, and we would like to discuss at your convenience what role you would like to have at this institution going forward. Thank you, she said. The meeting ended. People filed out in the particular uneven way of a room dispersing when not everyone has processed what just happened at the same rate. Hale's counsel guided Hale out first. Efficiently, the way you move someone out of a space when leaving quickly is a form of strategy. Emma stayed in her chair until the room was mostly empty. Gaines sat down next to her. They didn't say anything for a moment. The ventilation system ran. Outside the window, Denver was having a gray March morning, the mountains still invisible, the city going about the ordinary business of a weekday. You should answer the email, Gaines said. She looked at him. The NAVSOC request, he said. You should answer it. I haven't decided what to answer. I know. He looked at the table. I'm not telling you what to decide. I'm telling you to decide. A pause. You've been in the gap for 4 years, Emma. You built the gap. I understand why. But you can't half live in a thing. She thought about the parking lot at 4 a.m, the cold in the voicemail and the choice between the car and the doors. She thought about Coda's eyes. I didn't choose to come back into any of this, she said. No, Gaines said. It came to you. He stood up. That's usually how it works. He left. She sat alone in the conference room for another 3 minutes, looking at nothing, and then she stood up and went back to the floor. The next 4 days were procedural in a way that felt both slower and faster than normal. The NCIS inquiry continued. Arlo's team interviewed 14 people, including every nurse and resident who'd been in or near Trauma 1 during the night of March 4th. Emma was interviewed twice more, each time going through specific segments of the timeline in greater technical detail. She answered everything directly. She asked for nothing in the way of legal protection and took nothing in the way of legal exposure. She worked her shifts, she saw patients, she did the ordinary things. But the hospital had changed around her in the particular way that institutions change when a long-standing pressure is suddenly released. Not dramatic, not immediately visible, but perceptible in the way people moved and spoke and made eye contact in hallways. Denise told her, on day 3, that 2 of the nurses who had filed complaints against Hale in the previous 5 years had come back to HR independently to say they'd been told at the time that their complaints would affect their own employment status. One of them had left Harborview because of it. She was considering returning. On the afternoon of day 4, Lily Huang found Emma at the nurses' station during a quiet stretch between patients. Lily had submitted her witness statement to NCIS that morning. She looked lighter than she had on the morning after. The kind of lighter that comes from setting something down rather than from anything having gotten easier. "Can I ask you something?" Lily said. "Sure. How do you do it? Not the medical stuff." She paused, searching for the right phrasing. "The staying still thing. When he was telling you to step back and you knew he was wrong, how do you stay that, I don't know, contained?" Emma thought about it honestly. "I've been in places where losing your composure cost someone their life," she said. "You learn that staying still is its own form of action. Sometimes it's the most important one." A pause. "And sometimes you don't stay still. Sometimes you step forward and take the consequences." Lily looked at her. "Which one is harder?" "Stepping forward," Emma said, without hesitation. "Staying still is just training. Stepping forward is a choice." Lily nodded slowly. She looked like she was cataloging that somewhere. Vickers was moved out of the recovery unit on day 2 and into a standard surgical ward bed, chest tube removed, incision sites clean, clavicle fracture splinted and scheduled for surgical repair in 3 weeks. Emma saw him once a day. The visits were brief and functional. She checked his chart, asked about pain levels and mobility, made sure the nursing staff had everything they needed. On day 4, he said, as she was turning to leave, "Hartley told me what unit you were with." She paused. "She shouldn't have said that." "Maybe." He was quiet for a moment. 114th is gone, has been for a while. There are people in the current structure who have the same job, different designation. Some of them trained with people you trained. She turned back around. "Vickers," she said carefully, "what are you telling me?" He looked at her with the steady gray eyes of someone who has chosen their words before opening their mouth. "I'm telling you that the work you did on those teams didn't disappear when the unit did. It's still in the field. In the techniques, the protocols, the people who learned from the people who learned from you." A pause. "I'm telling you that matters." She looked at him for a long moment. "Get some rest," she said. She went back to the nurses' station and sat down and looked at her phone and thought about the email she hadn't answered. She thought about it for a long time. On the morning of the 6th day, she answered it. She kept it short. 3 sentences. She said she was willing to discuss the reserve program under specific conditions that she would articulate in a follow-up call. She said her response was contingent on a full review of what the role would require. She said she was not committing to anything until she understood the complete shape of what was being asked. She sent it before she could rewrite it. Then she put her phone in her pocket and went to see her first patient of the morning, a 61-year-old woman with a respiratory infection and a blood pressure that was trending in the wrong direction, who needed someone to sit with her for 10 minutes and explain clearly what was happening and what was going to be done about it. Emma sat with her for 12 minutes. She explained everything. It was day 7 when the last piece of the institutional picture assembled itself in full. The NCIS inquiry issued its preliminary findings to the hospital board, the state medical board, and the Naval Medical Command simultaneously. Emma received a copy through Forsyth. She read it in the break room with a cup of coffee that was, for once, actually good. Denise had found a new brand and ordered it without telling anyone. Just placed it in the break room as a kind of quiet gift to the people who'd had a difficult week. The findings ran to 18 pages. Emma read all of them. Hale was named specifically in 11 of the documented violations. The finding used the phrase willful disregard for patient safety twice and abuse of institutional authority 3 times. The documentation alteration finding was the most serious. It met the threshold for referral to the State Attorney General's office for potential criminal review. She set down the report. She thought about the 14 nurses. She thought about the patient who'd been discharged and readmitted. She thought about the 11 complaints dismissed without review. She thought about all the versions of that night that could have happened. The ones where she was in the parking lot and stayed in the parking lot. The ones where she was tired enough or beaten down enough or isolated enough that stepping forward hadn't felt like an option. She thought about how close some of those versions had been. Not hypothetically close, genuinely close. The kind of close where the difference is a single small decision that you make without knowing you're making it. She picked up her coffee. It was on her way back to the floor that Gretchen found her. Gretchen, who in the past week had visibly aged a small but perceptible amount, in the way that institutional leaders age when the institution they manage has been exposed as having systematically failed, and who was now navigating the particular purgatory of being responsible for a system that had needed to be broken before it could be fixed. "The board has formally asked me to convey," Gretchen said, slightly formal in the way she got when she was delivering information she'd rehearsed, "that they want to create a clinical review position, a new role, someone embedded in the ER with authority to flag cases where clinical decisions are being overridden without documentation of rationale." She paused. "They want to talk to you about it." Emma looked at her. "That's not a nursing role," Emma said. "No," Gretchen said. "It's not. I don't have the credentials for a clinical director position. The board is aware of that. They've already been in contact with the state nursing board about a pathway." She paused again, in the way of someone who has more to say and is measuring the right amount. "And Commander Forsyth's office has indicated that the JSOC reserve qualification, if pursued, would carry equivalent clinical authority recognition under the hospital's federal patient contract." Emma stopped walking. She stood in the middle of the hallway and looked at Gretchen. "When did that come through?" she asked. "This morning." Gretchen met her gaze directly. "Emma, I know this week has been, I know what it's cost you, and I know that some of what's happening now is things moving the way they should have moved a long time ago. But the board is serious about this, about the role and about who should fill it." Emma looked down the corridor, at the bay doors at the end, at the ordinary geometry of the ER on a Wednesday morning, patients and staff, and the specific controlled busyness of a place where people came when something had gone wrong and needed to be addressed. "I need to think about it," she said. "Of course," Gretchen said. Emma kept walking. She was halfway to the nurse's station when her phone buzzed. She looked at it expecting the JSOC number, or Forsyth, or Arlo. It was an unknown number, Colorado area code. She answered. "Carter," she said. Silence for a moment, then, "This is Dr. Raymond Kessler. I'm the incoming ER director at Harborview Medical Center. I start Monday." A pause. "I've been briefed on the events of this week, and on you specifically. I'd like to meet before I begin, if that's possible." Emma stopped walking. "What kind of meeting?" she asked. "Introductory," Kessler said. "I'd like to understand the department from your perspective before I step into it." Another pause. "I was told by several people independently that you're the person who sees this ER most clearly." She stood in the hallway with her coffee in one hand and her phone against her ear, and thought about several things simultaneously in the compressed way that you think when the shape of something is shifting fast and you need to keep up with it. "Friday afternoon," she said. 4 o'clock. I'll be here." "Thank you, Ms. Carter." She hung up. She stood for a moment. Then she went to the nurse's station, set down her coffee, picked up the top chart on the stack, and opened it. A 44-year-old man, chest pain, presenting vitals flagged for immediate assessment. She went to see him. She was 3 steps from the bay when she heard, from the administrative wing, from the direction of the conference room where 7 days ago she had sat across a table from a man who called her a nobody. A raised voice. Hale's voice. She recognized it immediately, the way you recognize things that have left a mark. He was there, in the building, which meant someone had let him through, or he had come through without being stopped, or the credential suspension process had a gap that no one had closed yet. She paused. 3 steps from the bay. Chart in her hand. She heard Forsyth's voice in response. Low, unhurried, the weight of it carrying without volume. She heard a third voice. Arlo. And then she heard, clearly, cutting through the administrative corridor with the particular clarity of a statement that has been carefully prepared and is being delivered to an audience that includes a court reporter. Dr. Victor Hale, you are being formally notified of a criminal referral to the Colorado Attorney General's office for document falsification and obstruction of a federal medical inquiry. The hallway went very quiet. Emma looked at the chart in her hand. She looked at the bay door in front of her. She pushed it open and went in to see her patient. Behind her, somewhere in the administrative wing, the sound of a man's career ending made no particular sound at all. Just a door, and then footsteps, and then nothing. The 44-year-old man's name was Gerald Marsh, and he was scared in the particular way that middle-aged men who have never been sick are scared when their body does something they didn't authorize. He had his arms crossed over his chest when Emma came in. Not defensively, but protectively, like he was trying to hold himself together from the outside. She introduced herself and sat down on the stool beside the bed and asked him to describe what he was feeling, and he described it the way people describe chest pain when they're afraid it means the worst thing, carefully, with the specific over-precision of someone who is trying to give the right answer in a test they didn't study for. She listened. She asked 3 follow-up questions. She looked at his vitals, looked at the EKG strip the tech had already run, pressed 2 fingers to his wrist. Your heart rhythm is normal, she told him. Your EKG doesn't show anything concerning. What I'm seeing looks more consistent with muscle strain than anything cardiac. Have you done anything physically demanding in the last 48 hours? He thought about it. I helped my brother move on Sunday. How much lifting? A lot, he said, with the expression of a man reconsidering several of his life decisions simultaneously. She almost smiled. Okay, we're going to run a troponin to rule out any cardiac involvement, and I want to look at your blood pressure trend. But I think what you're feeling is your chest wall telling you it moved a couch. It didn't want to move. He exhaled. The relief on his face was so complete it was almost physical. So I can't tell you definitively until the troponin comes back, she said. But my assessment right now is that you're going to be fine. We just want to confirm it. She ordered the labs, updated the chart, and moved to the next bay. The ordinary things. She moved through the morning doing them. Gerald Marsh's troponin came back negative 90 minutes later, and she discharged him with a printed instruction sheet about muscle strain management and a recommendation to maybe let his brother hire movers next time. He shook her hand before he left, which patients sometimes did, and which she always found slightly awkward and always accepted anyway. She saw 6 more patients before noon, a fractured wrist, an allergic reaction that was alarming in presentation and straightforward in treatment, 2 separate cases of what turned out to be flu in people who had convinced themselves it was something worse, a child with an ear infection whose mother was considerably more distressed than the child, and an elderly woman with a UTI who had been waiting patiently for 3 hours and who, when Emma apologized for the wait, said, "Honey, I've been waiting for things my whole life. 3 hours is nothing," in a tone that managed to be both wry and entirely sincere. Emma thought about that for a while after. At 12:30, she ate lunch in the break room. The real kind of lunch, sitting down, not standing over the counter eating half a sandwich between patients. Denise sat across from her and they talked about nothing consequential. A television show Denise had been watching, a restaurant that had opened 2 blocks from the hospital, the fact that the 3rd-floor coffee was now officially better than the ER coffee, and someone needed to address the equity issue. Normal conversation. Emma sat in it and let it be what it was. She was finishing her coffee when Forsyth appeared in the break room doorway. He looked at her across the room and she looked back, and the question was answered before either of them said anything. "He's leaving today," Forsyth said. "Vickers, transport to Bethesda for the clavicle repair." Emma nodded. "When?" 1400. She looked at the clock. 45 minutes. She went up to the surgical ward at 1350. Vickers was dressed, the specific careful way of someone managing a splinted shoulder and a healing chest, and sitting on the edge of the bed. Coda was beside him, leashed and vested, watching the door. When Emma came through it, the dog's tail moved in the slow, deliberate swing she'd come to recognize. Hartley was there. Two of Forsyth's staff, a transport medic going over discharge paperwork with the ward nurse. Vickers looked at Emma when she came in, and his face did the thing that faces do when someone has been waiting for a specific person to arrive and the person has arrived. "Heading out," he said. "I heard." She looked at his chart on the wall tablet, checked the discharge summary the way she always checked things. Not performatively, but actually. Everything was in order. "Bethesda is good. The orthopedic team there is solid." "You've worked with them?" "Adjacent to them," she said. He nodded. He understood what adjacent to them meant, given what he now knew about her history. "Coda's coming," he said. "I figured." "He doesn't usually travel well." Vickers looked at the dog. "But he won't go without me, so." Emma crouched down. She was at Coda's eye level, and he looked at her with the amber eyes that she had first seen across a trauma bay 8 days ago in the chaos of a night that had dismantled 4 years of careful distance. She put her hand out. He pressed his nose against her palm, held it there for a moment, then sat back. She stood up. "Carter," Vickers said. She looked at him. "I've been in the field with a lot of people," he said. "Medics, corpsmen, surgeons, the whole chain. You have the thing that the best ones have." He paused, looking for the words that weren't clinical. "You don't treat the injury. You treat the person who has it." Another pause. "That's not as common as it should be." She held his gaze. "Take care of yourself, Vickers." "You too." The transport team came in. Coda stood and moved to heel position beside Vickers' left side, the side away from the splinted shoulder without being told. Emma watched them go down the corridor. Vickers moving with the careful deliberateness of a body in recovery, Coda matched to his pace, Hartley and the transport team bracketing them. At the elevator, Vickers turned back. He didn't say anything. He just looked at her for a second, the specific look of someone filing something away in a place they intend to keep. Then the elevator doors opened and they were gone. Emma stood in the corridor for a moment. Then she went back to work. The meeting with Dr. Raymond Kessler happened on Friday at 4 o'clock as arranged, in a small office that had been cleared out and not yet refurnished after Hale's personal belongings were removed. There was a desk with nothing on it and 2 chairs and a window with a view of the parking garage and the slice of mountain visible above it. Kessler was younger than she'd expected from his voice on the phone. Early 40s, with reading glasses pushed up on his head, and a quality of attentiveness that she recognized, the kind that comes from having been in rooms where missing something mattered. He'd come from a level 1 trauma center in Phoenix, Gretchen had told her. Before that, 3 years doing emergency medicine consultation for a border health program. He shook her hand and they sat down and he said, "Tell me about this department. Not the official version." She looked at him. "What do you mean, the official version?" "The version in the quality reports and the accreditation files," he said. "That's not what I need. I need to know what this ER actually is, where the gaps are. Who knows what? Who gets listened to, who doesn't?" He paused. "I've been told you see it clearly." She thought about it. She spent a moment not performing consideration, but actually considering. Then she talked. She talked about the nurses, who they were, what they knew, where their knowledge was systematically underused. She talked about the resident rotation and the gap between what residents were taught in medicine and what they encountered in a real ER on a real night with real competing pressures. She talked about the triage process and 2 specific structural inefficiencies she'd identified years ago and never had standing to raise formally. She talked about communication patterns between nursing staff and attending physicians, the specific ways that information degraded as it moved up the hierarchy. She talked for 22 minutes. Kessler listened without interrupting. He wrote 3 things down, not on his phone, on a small notepad with a pen. Paper, she noticed. Like Arlo. The habit of people who'd learned to be careful about records. When she finished, he was quiet for a moment. "The board talked to me about the clinical review position," he said. "Yes. I want to make it more than what they described." He looked at her directly. "I want it to be a genuine authority role, not a consultative position that can be overridden. Actual clinical oversight weight. He paused. But that only works if the person in it is someone the staff already respects and the medical team already knows has the right judgment. Emma looked out the window. The mountain slice above the parking garage was catching the last of the afternoon light, the snow on the upper ridgeline catching it pink and gold. "I'm a nurse," she said. "That matters to me. I don't want to move into an administrative role that takes me away from patients." "The position is designed to be clinical," Kessler said, 50% patient-facing. The other 50 is oversight, case review, and training program development. Training program development. She looked at him. "Gretchen mentioned a training component," she said carefully. "The board wants to formalize what you did informally," he said. "The battlefield protocols, the austere environment training, the decision-making under institutional pressure. Build it into the residency program and nursing continuing education." He paused. "With your reserve qualification through JSOC, you'd have the credentials to run it." She was quiet. She thought about something Gaines had said. You can't half live in a thing. She thought about Vickers in the recovery bay saying, "Don't let them make it small." She thought about 14 nurses and 3 patients with adverse outcomes, and the version of that night where she had stayed in the parking lot. She thought about the woman that morning. "Honey, I've been waiting for things my whole life. 3 hours is nothing," and the wry, steady grace of it. "I need to confirm the JSOC pathway first," she said. "And I want to be involved in designing the training curriculum, not just delivering someone else's version of it." "Agreed," Kessler said immediately, like he'd expected both conditions. "And the clinical oversight role needs a clear escalation pathway. I flag something, there's a documented process for response. Not suggestions, process. I'll have legal draft the protocol before I start Monday." She looked at him. He looked back. He was someone who said what he meant and meant what he said, she thought. Or he was very good at presenting as that, and the next 6 months would tell her which. "All right," she said. They shook hands. She drove home in the Friday traffic with the window cracked and the cold air coming in off the mountains and something in her chest that felt different from what had been there a week ago. Not lighter exactly, differently weighted, like a thing had been redistributed rather than removed. The weeks that followed moved the way weeks do after a crisis has passed. Busy, ordinary, incrementally strange in the way that major changes are strange when they're happening through small daily steps, rather than in a single dramatic moment. The NCIS inquiry published its final report 6 weeks after the night of March 4th. It was 43 pages. Emma read it on a Tuesday morning before her shift. The findings were thorough and specific and named Hale in 31 separate violations. The language was bureaucratic and precise in the way of federal documents, but the meaning underneath it was clear. A man had been given institutional power and had used it to protect himself at the expense of patients and staff, systematically, over years, and the system had allowed it until it couldn't anymore. The Colorado Attorney General's office filed criminal charges on a Thursday. Document falsification, obstruction of a federal inquiry, and 2 counts of negligent endangerment tied to the patient cases from the board review. It was covered briefly in the local news, a paragraph in the Denver Post, a 40-second segment on the local evening broadcast. Hale's attorney issued a statement that said his client denied all allegations and intended to mount a vigorous defense. Emma saw the news segment on the break room television between patients. She watched it for the 40 seconds. Then she went back to the floor. She had, by that point, already begun the JSOC reserve qualification process. It involved 3 assessment days at a military medical facility in Colorado Springs, a review board, and a formal evaluation of her documented clinical history, including the declassified portions of her 114th service record. The process was not simple. There were forms and interviews and a medical evaluation that felt faintly absurd for someone who had just stabilized a tension pneumothorax in a hospital corridor, but she understood the purpose of it and went through it without complaint. The qualification came through on a Wednesday afternoon in April via email from Captain May's office. Emma read it in her car in the Harborview parking lot after her shift. The subject line said JSOC Medical Reserve Qualification, confirmed. The body of the email was formal and brief. The attached document was 7 pages. She sat in the car for a few minutes. Then she called Hartley. "It came through," she said when Hartley picked up. A pause. Then, "I know. Mays sent me a copy." Another pause, shorter. "How do you feel?" Emma looked through the windshield at the hospital, at the ambulance bay and the yellow parking lot lights coming on in the early April dusk, at the ordinary machinery of the place where something had broken open and something else had been built in the gap. "I feel like myself," she said. "Good," Hartley said. "That's the right answer." The clinical review position was formalized in April as well. The title was Clinical Practice and Safety Specialist, a name the board's HR committee had spent 2 weeks arriving at, and which Emma found somewhat cumbersome but had decided not to fight. The substance was what mattered. She had a documented escalation pathway, a seat in the weekly department leadership meeting, and authority to flag and formally review any case where clinical override or staff dismissal appeared to have influenced patient outcomes. In her first 6 weeks in the role, she flagged 4 cases. 3 were resolved with process corrections. The 4th resulted in a formal performance review for a physician's assistant who had been dismissing nursing assessments in a pattern that 3 different nurses had noticed and none had felt safe raising. The PA completed a mandatory review and corrective training. He did not lose his position. He did change his practice. It was not a dramatic outcome. It was a correct one. She was aware of the difference. The training program took longer to build than she'd expected because the things worth building always did. She worked on the curriculum in the early mornings before shifts and on her days off and in the occasional quiet stretches of the department that never lasted long but sometimes lasted long enough. She worked with a retired Army surgeon named Dr. Patrice Webb, who had done field medicine in 3 different humanitarian deployments and who had the quality Emma most valued in a collaborator. She told you clearly when she thought you were wrong. They disagreed on 3 sections of the curriculum. They argued the disagreements out in Webb's cluttered office, with printed drafts spread across the desk, and cold coffee, and the particular energy of 2 people who care about getting a thing right more than they care about being right. They reached compromises that were better than either of their original positions. That was how it was supposed to work. The first training cohort was 6 residents and 9 nurses. Emma ran the opening session herself. She stood at the front of a room that had been converted from a storage space into a training room with 12 chairs and a whiteboard and a projector that had taken 2 weeks to get working. And she looked at the 15 people in front of her, some of them young enough that she registered the youth clearly, the specific unselfconscious newness of people who hadn't yet had their judgment tested in the specific ways it was going to be tested. And she thought about what to say. Not what she'd planned to say. What was true. "The most dangerous thing in emergency medicine is not incompetence," she said. "It's hierarchy. Competent people who know something is wrong but have been trained so thoroughly to defer upward that they don't act on what they know." She paused. "This program exists because of exactly that. Because someone in this building was dismissed, and the dismissal had clinical consequences, and a patient almost died." Another pause. "I was the person who was dismissed. I'm telling you that so you know this isn't theoretical." The room was very quiet. "You are going to spend your career surrounded by people with more institutional authority than you," she said. "Some of them will be excellent. Some of them will be wrong. Your job is to know the difference and to act on the knowledge even when acting on it is uncomfortable, especially then." She looked at the faces. "That's what we're building here. Not just the technical skills. Those matter enormously and we'll spend a lot of time on them, but the muscle that lets you use the skills when someone is telling you not to." She taught for 3 hours that first session. Tactical triage, physiological prioritization under resource constraints, the specific decision trees of emergency thoracic intervention. She was exacting and direct, and she didn't soften the hard parts. When someone got something wrong in the simulation exercises, she told them clearly and showed them exactly what had gone wrong and why, without performance, without drama. At the end of the session, a second-year resident named Marcus, young, clearly sharp, with the careful confidence of someone who'd been good at things their whole life and was just beginning to understand that being good and being right were different skills, raised his hand. "What happened to the doctor?" he asked. "Hale, what's happening to him now?" Emma looked at him. "Criminal proceedings are ongoing," she said. He's no longer credentialed at this or any hospital pending the outcome. The state medical board review is separate from the criminal process and has its own timeline. She paused. He'll face consequences proportional to what he did. That process exists, and it's working. Does that feel like enough? Marcus asked. Not challenging, genuinely asking. She thought about it honestly. No, she said. If I'm being direct with you. No. Because the 14 nurses who filed complaints and were dismissed, they can't get those years back. The patient who was discharged too early can't undo the surgery he needed because of it. Consequences after the fact don't restore what was lost. She held the resident's gaze. That's why we're in this room. Because the goal isn't to have better consequences. It's to make the thing that requires consequences less likely. Silence. Then, from the back of the room, one of the nurses, a woman about Emma's age named Tara, who'd been at Harborview for 8 years, said, "That's the first time anyone said that out loud in this building." Emma looked at her. "Well," Emma said, "it should have been said sooner." The session ended. People filed out. Emma erased the whiteboard herself, the way she always did things she could do herself. She was pulling on her jacket when Kessler appeared in the doorway. He'd watched the last 40 minutes of the session from the back, which she'd noticed and hadn't commented on. "Well," she said. "Better than I expected," he said, "and I had high expectations." "We'll see how the second session goes," she said. "First sessions are easy. Everyone's paying attention because they don't know what to expect yet." He smiled at that. "How are you doing, overall?" She considered the question. It was the same question Gaines had asked her in the conference room weeks ago, and she'd said she was tired, which had been true and had been the most honest answer available at the time. She was less tired now, not rested. That was a relative condition in emergency medicine, but less tired in the specific way that comes from moving in a direction that makes sense rather than in a direction you've chosen because it's safe. "Good," she said, and meant it. She walked out of the training room and down the hall toward the ER. April light was coming through the windows at the end of the corridor, the specific bright flat light of a Colorado spring that made everything look slightly more real than usual. Through those windows she could see a slice of the mountains, fully visible today. The snow line still high, but the lower ridges going green at the edges. She thought about the parking lot at 4 in the morning, 8 weeks ago. The cold and the voicemail and the choice between the car and the doors. It had felt, in that moment, like a very small decision. Step forward or don't. Stay or leave. It had not felt like the kind of choice that changes the shape of things. She understood better now that small choices were exactly the kind that changed the shape of things. That was the thing about living carefully in a gap you'd built for yourself. You forgot that the gap was also a choice, and that not choosing was its own kind of choosing, and that some things, when they came to find you, deserved to be let in. She pushed through the ER doors. The department was running at its usual mid-afternoon pace, not frantic, not quiet, the particular alive hum of a place where people came when something was wrong and other people came every day to make it right. She could hear the monitors and the PA system and someone laughing at the nurse's station and the ordinary overlapping sounds of it all. Denise was at the station with a chart in her hand and looked up when Emma came through. "Bay 2 is yours," she said. 26-year-old, abdominal pain, presenting vitals are okay, but she's been waiting 40 minutes and she's uncomfortable. "On it," Emma said. She took the chart. She went to Bay 2. She introduced herself, sat on the stool, asked the young woman to describe what she was feeling. She listened. That was the work. It had always been the work. Not the heroics or the crises or the moments when everything converged at once and the decision was either right or wrong and someone's life was the difference. Those moments existed and they mattered. But what made those moments possible, what made it possible to be the person who knew what to do when it mattered, was the 10,000 ordinary moments before them. Every patient listened to carefully, every assessment done precisely, every piece of knowledge held in the body because the body had been asked to hold it consistently, every single day, regardless of who was watching. Emma Carter had spent 4 years trying to be smaller than she was. She had built the gap with genuine intention. She had needed the distance, and she had built it, and it had served the purpose it needed to serve. But the gap had cost her something too. She understood that now, on the other side of it. It had cost her the full use of herself. And the full use of yourself was not something you could afford to put in storage indefinitely, because the world kept presenting situations that required it. And when it did, the people around you paid the price of your caution. That wasn't guilt. It was just the honest accounting of it. She had stepped forward. She had taken the consequences. The consequences had been, in the end, not what she'd feared, which was the way consequences sometimes went when you stopped running from them and stood still long enough to see their actual shape. She was here. She was doing the work. The past was not something she was hiding from anymore. It was something she was built from. That was enough. It was more than enough. The woman in Bay 2 had a presentation that, after a careful assessment, turned out to be a ruptured ovarian cyst. Painful, significant, needing monitoring and pain management, but not dangerous. Emma explained it clearly. The woman asked 4 questions, each more precise than the last. The questions of someone processing difficult information and refusing to take it at less than full resolution. Emma answered all 4 fully. "Thank you," the woman said when Emma was done, "for actually explaining it. Other people kept using words that went over my head and didn't stop to check." "That's something we're working on," Emma said. She updated the chart and moved to the next bay. Outside, the April light was holding. The mountains were still visible through the corridor windows at the end of the hall. The ER was running and the department was functional, and the training room down the hall had 15 people who were going to be better at their jobs because of what they'd learned today. And tomorrow there would be more. It wasn't a perfect system. It wasn't going to become one. Systems didn't become perfect. They became better, incrementally, through the sustained effort of people who refused to accept that what was broken was simply the permanent shape of things. Emma Carter had spent a long time being underestimated. By institutions, by individuals, by the particular kind of person who confused authority with competence and used one to compensate for the absence of the other. She had been called nobody, floor nurse, basic, a nobody who didn't belong near critical cases. She had been all of those things at various points in her life. She had also been, at the same time, someone whose knowledge had saved lives in 3 countries and 1 trauma bay in Denver, Colorado, on a night in March when the system had tried to lock the door and she had declined to stay outside it. That was not a story about being exceptional. It was a story about being present and prepared and refusing to disappear when disappearing was easier. She moved through the rest of her shift the way she'd moved through thousands of shifts, patient by patient, problem by problem, one hand reaching for the next thing that needed to be done. At the end of it, she pulled on her jacket at the nurse's station and said goodnight to Denise and walked out through the ER doors into the cool April evening. The mountains were dark now, against a sky that hadn't fully decided between blue and black. The parking lot lights were on. The cold was the clean kind, the Rocky Mountain kind that had no memory of the day in it. She stood outside for a moment. She thought about the woman in Bay 2 who had asked 4 precise questions and deserved 4 precise answers. She thought about Marcus, the resident, who wanted to know if the consequences were enough. She thought about Coda's amber eyes and Vickers' steady gray ones, and Hartley's voice on the phone saying that's the right answer. She thought about 14 nurses and the gap between what people knew and what they felt safe saying, and the small difference between those 2 things and the enormous cost of that difference when it went unaddressed. She thought about Hale, facing a process that would take months and produce an outcome that was neither justice in the full sense nor sufficient recompense for what had been lost, but was the actual available thing, which was what you worked with. She thought about stepping forward, not once, not in a single defining moment, but consistently, daily, in the small ways that added up. Speaking the correct assessment when someone said not to, adjusting the needle angle when the angle was wrong, staying in the parking lot when the message said don't leave, walking back through the doors. That was the real thing, not the rescue, the refusal to be made small, again and again, in the ordinary moments before the rescue was required. She walked to her car. She drove home with the windows cracked and the mountains black against the sky, and the road opening up in front of her, clear and direct, going exactly where she intended.